The Rickey Smiley Morning Show.
It's the front page news.
It's what's trending now.
Man, COVID-19 hospitalizations are reaching at all-time highs once again in parts of the country. Some hospitals are running out of beds with patients unable to get the care they would normally receive. So Dr. MJ Collier is back with us this morning. So if you have any questions, call 866-9-RICKEY, 866-9-RICKEY, and he will do his best to answer each and every one of them. Good morning, Dr. MJ Collier.
Good morning, Rickey, and thank you so much for allowing me the opportunity to give this COVID-19 report, because I'm telling you, the news is not good. But new reports from the Center for Disease Control and Prevention noted that people who have had one bout of COVID-19, that's any variant, and they get vaccinated, they get a dramatic boost in virus-fighting immune cells and a bonus of broader protection against the new mutations and variants. So, there's a discussion on the internet, and this is true, that if you have had it, then you have natural immunity. That is without question a scientific fact. However, you get better immunity and more broad spectrum coverage if you get the vaccine. Now, bad news out of the city of Atlanta, Rickey. We had a married couple, female 25, male 29. Both of them got COVID. The man died yesterday, and it was a tragedy. She said she never thought she'd be a widow at 25. The difference in the two cases being she got the vaccine, he didn't get it. Oh. And his last dying wish was to dramatically ask everybody. He said he got caught up in bad information that he saw on the internet, and he didn't want to take it. And so he was begging, could he get it? It was too late at that time. He passed away, unfortunately, and now she's a 25-year-old widow from coronavirus. So get your vaccines, everybody. Get your vaccines. What questions do we have?
All right, man. We finna go to the phone lines, taking your calls. Rickey Smiley Morning Show. You are on with Dr. Collier. Good morning.
I've had coronavirus, and after getting coronavirus, I got the Johnson & Johnson vaccine. So what is my protection against these new variants that are coming out?
Okay, great question, and you have great protection because you did have natural immunity that's being added upon by getting the Johnson & Johnson vaccine. So my medical opinion is that you get better protection with the mRNA vaccines, but you do get great protection with the adenovirus Johnson & Johnson vaccine as well. So you are now a super soldier, and you have a great level of protection having gotten vaccinated after having gone through the coronavirus infection.
Rickey Smiley Morning Show, you're on with Dr. Collier. Good morning.
Actually, I wanted to know, since this new strand is coming out, is it safe could we get another COVID shot, or is that just out of the question?
Okay, if you said another, so that means you've gotten already. If you are fully vaccinated, meaning you've had 2 doses of the 2-dose vaccines or 1 dose of the single dose Johnson & Johnson, then you have protection. It's not necessary to get a booster shot at this time. They are starting to consider additional shots in people that are immune compromised. But for regular people with normal health, if you've had both shots and you are fully immunized, then you have protection already, so you don't have to worry about it. You can go back to DEFCON 5, woosah and relax. You have protection because you are vaccinated.
Rickey Smiley Morning Show, you are on with Dr. Collier. Good morning.
My question is, I went to the health department, took my grandson to go get a COVID shot, and they were advising not to take the Tylenol prior to getting the shot because it may affect the shot. Is that true?
One, Tylenol is an antipyretic. It just stops pain. It does not help with inflammation. I think that was a point that was brought out about 9 months ago. They have realized that taking the anti-inflammatory does not impact your immunity, but it does substantially impact your soreness, sore arms, and side effects potentially from getting the vaccine. So Dr. Collier, in his medical opinion, recommends that you start taking an anti-inflammatory such as Motrin, Advil, or Aleve the day before the shot. Continue it for the next 2 days after getting the shot, and that should minimize particularly the sore arm, but it should not impact negatively your immunity that you achieve from being vaccinated.
We got time for one more call. Rickey Smiley Morning Show, you're on with Dr. Collier. Good morning.
Question for the people that's vaccinated and the people that's not. Now that we're seeing the vaccinated people getting sick and some are dying, what can you say or change the minds of the non-vaccinated people? What could possibly be done to ease our minds with this whole situation?
Okay, remember the fact that the vaccine is 95% protective. And of those 5% that are remaining, you will have some breakthrough infections. But of the individuals that have gotten infections after being vaccinated, the actual number is more like 1.8%. So we're not even approaching the 5% that's been shown statistically correct. So, and people that are getting infected are having milder infections, not being hospitalized, and not dying. So there's no downside to getting the vaccine. I highly recommend that you do. I'm reiterating, Dr. Collier has had the vaccine. All of my family members have had the vaccine, and all of my staff have had the vaccine. So I'm a true believer in being vaccinated, and I recommend that all of Rickey Smiley Morning Show listeners go get that vaccine today. Don't put it off. You can walk in anywhere you get your medications. Get that vaccine today.
Go ahead and give your disclaimer, Dr. Collier.
Okay, these are the medical opinions of Dr. M.J. Collier, not those of Rickey Smiley, Rickey, or the production staff of the Rickey Smiley Morning Show crew or its staff members. You can listen to Dr. M.J. Collier on all social media at ASK Dr. MJ, and watch out for my Facebook Live this Wednesday. We're going to start another live session. You can call in and ask your healthcare questions. We look forward to talking to you.